Julie Joby, educator from Bright International Education. Today I am before you to give some introduction on NCLEX-RN examination. Most of you would be knowing that US and Canada are the countries that had already accepted this examination to work as a licensed nurse, whereas now Australia has also accepted this examination. That's really a glad news, isn't it? Would you like to know a little more on this NCLEX-RN examination? I am there to explain what is NCLEX-RN. The abbreviation NCLEX-RN stands for National Council Licensure Examination for Registered Nurses. There is also NCLEX-PN, which means National Council Licensure Examination for Practical Nursing. So what is the purpose of this examination? The purpose is mainly to assess whether you are able to deliver a safe and effective care. That is, whether you are fit to practice as an entry-level nurse and whether you will be able to deliver a safe and effective care. Which means that, let me be a little more clear on this aspect. So if suddenly an emergency situation arises, for example, if a person has come to your department with chest pain, so what are you going to do immediately? There are many things to be done, isn't it? You can give oxygen, you can provide painkillers, or you can call the doctor. What are you going to do suddenly? So there could be many other situations like this wherein you will be in a dilemma not knowing what to do. So the questions in RN examination will be checking whether when a situation arises, whether you will be able to deliver a safe and effective care. So I will be letting you know how this examination is assessed and what are the content areas that will be arising or how the questions will be. NCLEX-RN examination is a computer adaptive test, which means that computer will be assessing whether you are fit enough to make clinical judgment during a scenario or in a scenario. So how is this assessed? What is the total number of questions? Usually the total number of questions ranges from 75 to 265. Whereas now, due to COVID-19 impact, until September, as per the rules, the number of questions have come down from 60 to 130. Previously, it was up to 6 hours, whereas now the total number of hours has also reduced, that is, it has come down to 4 hours. This is only because of the COVID-19 impact until September 30. Or else, usually the NCLEX-RN number of questions ranges from 75 to 265 and the total time will be for 6 hours. So how is this assessed? What do you understand by 75 to 265? Let me be a little more clear on this aspect. That is, just imagine there is a graph, okay? And this is the passing line. Just imagine a graph with a passing line. Computer will be giving questions. The questions are set in such a way that neither it will be too easy nor it will be very difficult. So the questions will be given in such a way that you will be able to answer it if you are having the sufficient skills or if you are thorough enough in that particular subject. Okay, so as I told you, this is the passing line, and whenever you answer rightly, your graph shoots upward, and if you are wrong in your answer, your graph goes down. So by the time you reach 75th question, if the computer is confident, that is, it is something called as 95% confident level is taken into consideration. If the computer is 95% confident that even if the rest of the questions are given, you will be staying above the passing line, then your results will be considered as pass. Or if the computer by the time you reach the 75th question, if it comes to a decision that even though like if the other questions are given, so you will be staying below the average line, then your results will be fail. So by 75th question, so computer, if it is 95% confident about your result, then automatically it shuts off. Sometimes, so it will not be confident. So in that case, then your session moves on. It will be moving till you complete or till the computer becomes confident like what could be your result. This is how it is assessed. So there is something called as run out of rule. Okay. So there is something else that is called as run out of rule, which we call as ROOT, okay, run out of time rule. So wherein, suppose like even though you have like the time is over, like 6 hours is over, whereas still you are in your 250th question, then the computer will be taking your previous 60 questions into consideration and it will be assessing whether you are above the passing line or below the passing line. So this is how the examination is assessed. Hope you have understood how the assessment is done in NCLEX-RN examination. In the next videos, I will be letting you know the types of questions in the examination and also the content covered, how to answer the questions and also how to study. To get notified about the upcoming videos, kindly like and subscribe this channel. See you in the next video. Thank you.